Information and Communication Technology, ICT, has had a transformative impact on the healthcare industry, improving patient care, efficiency, and overall outcomes. Here are some key areas where ICT is being utilized in healthcare. Electronic health records, EHRs. EHRs digitize patient medical histories, treatments, prescriptions, and other relevant information. This streamlines data sharing among healthcare providers, reduces errors, and enables better coordination of care. Telemedicine and telehealth. Telemedicine allows patients to consult with healthcare professionals remotely using video calls, phone calls, or even text messages. This is especially useful for remote areas and follow-up appointments, reducing the need for in-person visits. Mobile health. mHealth mobile apps and devices enable patients to monitor their health, track medications, record symptoms, and communicate with healthcare providers. This has led to better patient engagement and self-management of health. Health Information Exchange, HIE systems allow secure sharing of patient information between different healthcare organizations. This improves care coordination and ensures that critical patient data is available to authorized providers. Medical imaging and diagnostics. Advanced imaging technologies such as MRI, CT scans, and X-rays have benefited from ICT, allowing for better visualization, analysis, and storage of images. Teleradiology also enables remote interpretation of images by specialists. Healthcare analytics. Big data and analytics help healthcare organizations make informed decisions by analyzing trends, predicting outbreaks, identifying disease patterns, and improving resource allocation. Clinical Decision Support Systems, CDSS. These systems provide healthcare professionals with evidence-based recommendations for diagnosis and treatment, enhancing clinical decision-making. Robotics and automation. Robots are being used for tasks such as surgery, medication dispensation, and repetitive tasks in hospitals. Automation also aids in managing administrative tasks and supply chains. Remote monitoring and wearable devices. Wearable devices like fitness trackers and smartwatches can collect real-time data on a person's health metrics, such as heart rate, sleep patterns, and activity levels. This information can be shared with healthcare providers for proactive management. Virtual reality, VR, and augmented reality, AR. VR and AR technologies are being explored for medical training, pain management, and even as tools for surgical planning and simulation. Healthcare IoT, Internet of Things. IoT devices are used to monitor patient vitals, manage medical equipment, and improve patient safety by alerting healthcare staff in case of emergencies. Data security and privacy. With the increased digitization of health data, ensuring the security and privacy of patient information is crucial. Robust encryption, access controls, and compliance with regulations like HIPAA are vital in ICT systems for healthcare. Health Information Management Systems. These systems help manage patient records, appointments, billing, and administrative functions in healthcare facilities. Genomic medicine. ICT has played a significant role in the field of genomics by enabling the storage, analysis, and sharing of vast amounts of genetic data for research and personalized medicine. Overall, ICT has revolutionized healthcare by enhancing communication, improving patient outcomes, reducing costs, and enabling the development of innovative medical solutions. However, it's important to address challenges such as interoperability, data security, and ethical considerations as these technologies continue to evolve.